Hello, my name is Reyes. I am a chemical engineer and author of science books. My talk is for educational purposes only. Do not take this as your medical advice. For your specific health conditions, always check with your medical doctor. I will talk about the ketogenic diet for epilepsy and Alzheimer's disease. The outline of my talk are: number 1, keto for epilepsy; number 2, keto for Alzheimer's disease; and third, sample keto meals. First, keto for epilepsy. The origin of the ketogenic diet used for medical treatment was in 1921. Endocrinologist Roland Woodyard noted that three water-soluble compounds, acetone, beta-hydroxybutyrate, and acetoacetate, together called ketone bodies, were produced by the liver as a result of starvation, or if they followed a diet rich in fat and low in carbohydrates. Russell Wilder from the Mayo Clinic called this the ketogenic diet and used it as a treatment for epilepsy. There are other variations of the keto diet, such as the MCT diet, Atkins diet, low glycemic index treatment, and the recent modern ketogenic diet regimens. For the management of epilepsy, here are the frequently asked questions. First, what is the ketogenic diet for epilepsy? The classic ketogenic diet is a special and effective high-fat, low-carbohydrate, and adequate protein diet that helps to control seizures in some people with epilepsy. It is prescribed by a physician and carefully monitored by a dietitian. It is usually used in children with seizures that do not respond to medications. Keto for epilepsy requires careful measurements of calories, fluids, and macronutrients. The name ketogenic means that it produces ketones in the body. Ketones are formed when the body uses fat for its source of energy. The body uses carbohydrates like sugar, bread, and pasta for its fuel. But because the ketogenic diet is very low in carbohydrates, fats become the primary fuel instead. The brain can derive energy from the ketone bodies produced. Nutritional ketosis in the ketogenic diet is not dangerous, unlike ketoacidosis. Moderate ketone levels will lead to improved seizure control. Who will it help? Doctors recommend keto for children whose seizures have not responded to several different seizure medicines. The ketogenic diet has been shown in many studies to be particularly helpful for various epilepsy conditions. These include infantile spasms, Rett syndrome, tuberous sclerosis complex, Dravet syndrome, DUS syndrome, pyruvate dehydrogenase deficiency, and GLUT1 deficiency. Infants can be successfully started on this dietary therapy too. The diet works well for children with focal seizures, but may be less likely to lead to an immediate seizure-free result. In general, keto can always be considered for the young and old, as long as there are no clear metabolic or mitochondrial reasons not to use it. The diet is sometimes started to help reduce or even stop anti-seizure drugs. What is it like? The typical ketogenic diet provides 80% of calories from fat, 15% of calories from protein, and 15% of calories from net carbohydrates. When the classic ketogenic diet is prescribed, the total calories are matched to the number of calories the person needs. For example, if a child is eating a 1500 calorie regular diet, it would be changed to a 1500 calorie ketogenic diet. For example, for total calories per day of 1500, fat will be 1200 calories or 133 grams or 80%. Carbohydrates will be 80 calories only or 20 grams or 5%. And protein will be 220 calories or 55 grams or 55% of total calories. The kinds of foods that provide fat for the ketogenic diet are animal fats such as tallow, lard, butter, fish oil, all-purpose cream, tropical oils such as coconut, avocado, and olive, and functional oils like MCT, C8-MCT, and liquid coconut oil. Ideal ketosis for seizure control is at ketone levels of 2.4 to 5.0 millimole per liter on blood testing. Because the amount of carbohydrate have to be restricted and protein moderated, it is important to prepare meals well in advance. What happens first? Typically, the diet is started in the hospital. The child traditionally begins by fasting, except for water, under close medical supervision for 18 to 24 hours. Alternatively, the child can immediately be given the ketogenic macronutrient ratios to begin the keto or fat adaptation period. The primary reason for admission in a hospital is to monitor for any increase in seizures on the diet, ensure all medications are carbohydrate-free, and educate the families. Does it work? Studies have shown that the ketogenic diet does reduce or prevent seizures in many children whose seizures could not be controlled by medications. Over half of children who go on the diet have at least a 50% reduction in the number of their seizures. 10 to 15% of children even become seizure-free. Children who are on the ketogenic diet continue to take seizure medicines. Some are able to take smaller doses or fewer medicines than before they started the diet. This is usually attempted after 1 month on the diet. If the person goes off the diet for even one meal, it may lose its good effect. So it is very important to stick with the diet as prescribed. Are there any side effects? A person starting keto may feel sluggish for a few days after the diet is started. Make sure to encourage carbohydrate-free fluids, enough water, and sufficient electrolytes of potassium, magnesium, and sodium, especially during illnesses. Other side effects that might occur if the person stays on the diet for a long time are kidney stones. Drink sufficient water and replenish electrolytes. High cholesterol levels in the blood. Recent studies show that elevated cholesterol and LDL cholesterol are not a concern on a ketogenic diet due to optimal triglycerides, HDL cholesterol, and the triglycerides to HDL-C ratio. This means that the type of LDL is the large and buoyant ones called pattern A, which are cardioprotective. Constipation. This is addressed by drinking enough water and electrolytes. Slowed growth. Eating nutrient-dense and whole foods like animal meats are important to get the complete nutrients needed daily. Take supplements as necessary. Bone fractures. To avoid this, do regular exercise, particularly resistance exercises, and supplement with calcium, vitamin K2, vitamin D3, and magnesium. Are any other medicines changes needed? Usually, there are no anticonvulsants that should be stopped while on a diet. Topiramate and zonisamide do not have a higher risk of kidney stones while on a diet, but zonisamide can increase the chance of stones. All medication should be in as carbohydrate or sugar-free form to avoid hidden sugars. Most liquids are changed by pharmacists to pills. How is the patient monitored over time? Early on, the doctor will see the child every 1 to 3 months. Blood and urine tests are performed to make sure there are no medical problems. The height are measured to see if growth has slowed down. Can the diet be stopped? If seizures have been well controlled for some time, usually 2 years, the doctor might suggest going off the diet. The person is gradually then taken off the diet over several months or even longer. Seizures may worsen if the ketogenic diet is stopped all at once. Children continue to take seizure medicines after they go off the diet. In many situations, the diet has led to significant but not total seizure control. Families may choose to remain on the diet for many years in these situations. Let's go now to keto in Alzheimer's disease. Alzheimer's disease is a progressive neurodegenerative disorder characterized by the accumulation of beta amyloid plaques and neurofibrillary tangles in the brain, leading to cognitive decline and memory loss. As the prevalence of Alzheimer's continue to rise globally, researchers are exploring innovative therapeutic approaches to mitigate its impact. One such approach gaining attention is the ketogenic diet. Originally developed to treat epilepsy, KD or keto is a high-fat, low-carbohydrate diet that induces a state of ketosis in the body. Mechanisms of action. Several mechanisms underlie the potential therapeutic effects of keto in Alzheimer's disease. First, energy metabolism. The brain's preferred energy source is glucose. In Alzheimer's disease, there is a diminished ability to utilize glucose efficiently. Keto provides an alternative energy source in the form of ketone bodies, which the brain can utilize more efficiently, potentially compensating for the impaired glucose metabolism. Neuroprotection. Ketone bodies possess neuroprotective properties, reducing oxidative stress and inflammation, both of which contribute to the progression of Alzheimer's disease. The diet's anti-inflammatory effects may help protect neurons from damage and support overall brain health. Beta amyloid clearance. Studies suggest that keto may enhance the clearance of beta amyloid plaques, a hallmark feature of Alzheimer's disease. By promoting autophagy, the cellular process responsible for removing damaged or dysfunctional components, the diet might facilitate the removal of these beta amyloid aggregates. Next, mitochondrial function. Mitochondrial dysfunction is a common feature in neurodegenerative diseases, including Alzheimer's. Keto has been shown to enhance mitochondrial function, promoting cellular energy production and overall neuronal health. Next, anti-inflammatory effects. Chronic inflammation is implicated in the pathogenesis of Alzheimer's disease. Keto has demonstrated anti-inflammatory effects, potentially reducing the inflammatory cascade that contributes to neuronal damage. Scientific evidence. First, evidence from preclinical studies. Several preclinical studies have provided promising results regarding the benefits of keto in Alzheimer's disease. For example, a study conducted on transgenic mouse models of Alzheimer's demonstrated that keto reduced beta amyloid plaque deposition and improved cognitive function compared to a standard diet. Additionally, the diet was associated with increased levels of brain-derived neurotrophic factor or BDNF, a protein crucial for neuronal survival and plasticity. Next, clinical studies and observational evidence. While clinical studies offer valuable insights, clinical research is essential for determining the efficacy of keto in human subjects with Alzheimer's disease. Limited clinical studies have been conducted to date, but some have reported positive outcomes. A clinical trial published in the journal Neurology and Therapy investigated the effects of keto on cognitive function in individuals with mild cognitive impairment, a condition often considered a precursor to Alzheimer's disease. The study reported improvements in verbal memory performance after 6 weeks of adherence to keto. In another study, researchers explored the impact of a ketogenic diet on Alzheimer's patients over a 12-week period. The results indicated improvements in daily function and cognitive performance, providing further support for the diet's potential therapeutic role. Next, challenges and considerations. Despite these very promising findings, challenges and considerations surround the implementation of keto as a therapeutic intervention for Alzheimer's disease. First is on adherence and feasibility. Adhering to keto can be challenging for individuals, particularly older adults or those with pre-existing health conditions. The diet requires strict carbohydrate restriction, which may pose practical challenges for sustained adherence. Long-term safety. The long-term safety of keto, especially in older populations, remains an area of concern. Limited data exists on the potential risks and side effects associated with prolonged adherence to keto. Next is individual variability. Responses to keto can vary among individuals. Genetic, metabolic, and lifestyle factors may influence how someone responds to the diet, making it crucial to consider personalized approaches. Next, need for further research. While existing studies suggest potential benefits, more extensive and rigorous research is needed to establish keto as a reliable therapeutic option for Alzheimer's disease. Larger clinical trials with diverse populations and longer durations are essential for drawing robust conclusions. To conclude, keto's potential as a therapeutic intervention for Alzheimer's disease is a topic of growing interest in the scientific community. As research in this field continues to evolve, keto holds promise as a complementary approach to conventional Alzheimer's disease management. Further investigations, including well-designed clinical trials, are crucial to validate its efficacy, identify optimal dietary parameters, and address safety concerns. Keto's potential to enhance energy metabolism, exert neuroprotective effects, and modulate key pathological processes in Alzheimer's disease makes it a compelling avenue for exploration in the pursuit of effective therapeutic strategies. Lastly, here are sample keto meals. In keto, pork dishes like bacon express, pork sisig, lechon, pork adobo, and pork binagoongan. Beef dishes like beef steak, bulalo, beef rendang, beef shank adobo, and burger patties. Fish dishes like paksiw na bangus sa gata, ginataang tilapia, baked salmon, Spanish-style sardines, and ginataang tuna. Combinations of meats and veggies which are green, leafy, and cruciferous. Keto drinks like bulletproof coffee, coconut milk, water, and tea. Keto desserts like keto fat bombs. In summary, I talked about the following. Number 1, ketogenic diet for epilepsy. Number 2, ketogenic diet for Alzheimer's disease. And number 3, sample keto meals. Thank you for your time.